As a young girl, I always loved setting out on a new adventure. As an adult, I was ready for the newest adventure in my life, the birth of our first child. After delivering a healthy baby boy, my heart stopped beating, and it took over an hour to bring me back to life. We were taken back to begin the start of a very anticipated event. While in labor, my parents and husband began to notice mental and physical changes in me that weren't right. This is definitely not our daughter. This is not my wife. What's going on? So the nurse listened to my family, and I'm so thankful she did. Because they took my temperature and it was 106. Later, I was diagnosed with a rare infection that threatened the life of me and our unborn baby. The doctors had to do an emergency C-section, and thankfully, our 6-pound baby boy was born. My husband was walking down the hallway, excited and ready to see me and make sure everything was good. And all of a sudden, code blue came over the intercom, and he saw the nurse begin CPR right in front of him. I had one nurse tell me that she heard a doctor say, "She just had a baby, and we're not giving up." For over an hour, the medical team worked tirelessly and relentlessly, and they got me back. My heart started to beat on its own, but the infection was taking its toll, and I had to have another emergency surgery. When I woke up and I couldn't move my arms and fingers, and I couldn't remember short-term things, it was a shock. I didn't remember even having our baby. And it dawned on me, the nurse had become the patient. We think we know, because we work with patients every day, what it means to be a patient. And I learned a lot. The nurses that I knew were genuine with me would walk in that room and their whole world was me. They shut the door behind them. They had a smile on their face. It was during this time that I had a newfound respect for environmental services and my care partners. They'd come in with a smile on their face. And it was such a breath of fresh air. And they didn't ask me how I was. I didn't want them to. They'd just come in and be humming a song or ask me about, "Oh, did you see this on the TV? It's sunny outside and such is in the news." And I was so thankful for that. And it seemed so little. But they took me beyond those walls. I know it takes a whole team, including the family. I also realize the impact that one person can have in my determination to get better. I don't think she realized that I was awake. She put her bare hand on me. And she said, "Girl, God has a plan for you." Our son is almost 2 years old now, and I look at life through a new lens. Well, life is very good right now. just a blessing every day. It really, truly is. During my recovery, I completed my master's degree, and now I am a nurse educator and instructor for East Carolina University. I'm bringing my newfound insights as a patient to my students. I am also caring for and riding my horses and loving every minute with my family. The message that I want to give is that it's not a matter of if something's going to happen to you or if you're going to be a patient one day. It's when. When you're a patient, what kind of nurse do you want to have? What kind of care partner do you want? Who do you want taking care of your mama and your daddy, your child? What kind of doctor do you want? And be that person.